Hello, good afternoon, and namaste from India. Welcome to another case study series podcast on dlife.in channel. I'm your host, Ira Sahai. I'm a practicing low carb nutrition coach with a background in media. I've been on the editorial board of some of the better known print and digital media. I work with people who need help with type 2 diabetes, obesity, and other metabolic health disorders for putting the disease into stable remission or managing the same with minimum medication. For autoimmune disorders, I primarily focus on the carnivore diet, having reversed my own membranous nephropathy through the carnivore diet. A podcast covering my own journey of the remission of membranous nephropathy is now documented and uploaded on YouTube for watch. I'll leave the link in the show notes below. You can watch it from there. As for people with other metabolic health issues, I take the regular LCHF and keto approach to put the disease into stable remission. I'm also a proud member and part of the acclaimed D-Life community. D-Life was founded in 2014 by a dynamic and brilliant man, Anup Singh, who's an engineer from IIT Roorkee and also a type 2 diabetic since February 2011. When diagnosed with type 2 diabetes, Anup completely turned around the game for himself by going low carb and is currently living a pill-free life. It was Anup who essentially pioneered and came up with what is now a widely quoted and practiced idea of 100 grams carbs per day as the upper limit of a low carb diet, keto being a small subset of that. D-Life has more than 250 Indian success stories of diabetes, hypertension, weight loss, fatty liver, reversal among others, and more than 1,000 Indian low carb keto recipes. In 2021, Anup Singh in 2021, Anup Singh and D-Life were awarded the very prestigious Icons of India Award by the Outlook Group. What started as a community in August 2014 has now become a powerhouse of LC platform in India, the low carb platform in India, evolving into a top-notch lineup of the best low carb nutrition coaches and metabolic health experts in India. D-Life also offers its highly exhaustive and award-winning course on low carb nutrition with a focus on metabolic disorders remission and management through lifestyle changes. The acclaimed D-Life courses have now got a wide acceptance, appreciation, awards, and enrollments too. You can check out our website, elearning.dlife.in. I'll link it for you in the show notes below. So coming back to the podcast, today I have a very special guest with me, the iconic Mr. Shashikant Iyengar, who's also India's most certified metabolic health coach. I'm proud to say that Shashi is also my mentor, and it's a pleasure having him on the hot seat today. Before we begin, I finally have some exciting news for our audiences too. Shashi's organization, Metabolic Health India, is organizing a metabolic health conference in collaboration with Reclaim Health India and D-Life Healthcare Foundation, which is going to be India's first ever low carb conference and will see a beeline of celebrity guests from across the globe. And those are the best in metabolic health and nutrition space. So please block your dates for October 27, 28, 29 for this star-studded mega conference. And it's a free to attend event. So I hope to see all of you there. Welcome, Shashi. Although you're well known in the low carb space, both within and outside India, for the benefit of our viewers, would you like to say a few words about yourself, introduce yourself, please?
Yeah. Ira, thank you very much for the very nice introduction. The one correction I'll make is it is not a conference which I am organizing. It is a conference which all of us are organizing from D-Life. So I think it is a contribution coming from each one of us, and this program would not be possible without everyone actively participating. So it's a sort of, we are all doing it together is what I'll say. And I think there's a small contribution of what we are doing to the society, because India is now in the throes of huge metabolic syndrome, millions of people suffering from diabetes, pre-diabetes, hypertension. People should know that low carb is an option which they can adopt. So this is my option. I don't say that low carb is the only thing, but I say it's a very good option which they should actually go for it. Regarding me, I think people know quite a bit about me in various podcasts. So I'm a type 2 diabetic in remission. It's almost 8 years now. And thanks to D-Life, thanks to Anup Singh, I learned a lot about low carb. And I not only low carb, but I went into ketogenic state for quite a long time, and managed to get my diabetes into remission with an average HbA1c mostly now around 5. Plus, along with it, lot of overcoming lot of other issues like bone and joint issue like osteoarthritis, tendinitis, cervical spondylitis, getting them under control. So they're all there, but we can say they're all under remission. They're all controlled by low carb. Plus, one of the big win I had was getting rid of, or at least lowering the intensity of tinnitus, which I have.
Oh,
So
wow.
I used to have something which I had approached a lot of doctors earlier, but it never got resolved. So now the intensity is only 10, 15, 20%. So depending. So if I eat a lot of carbs, then it will start ringing again. So tinnitus is reduced. I will not say tinnitus is gone. It is there. It is reduced. And along with all these, like when D-Life launched the diploma course back in 2020, so we had done that. So I had also done that in. I'm the second person to do here. And along with that, host of other certification, Nutrition Network, South Africa, American Nutrition Association, plus a lot of other master classes here and there combined. So recently, I also done the Advanced Sports Practitioner certification of Nutrition Network, which is a little advanced one, and it is very few people are actually
I
selected.
think that is the first in India also, Shashi.
That's also the first in India. And I also been accredited by Society of Metabolic Health Practitioner USA as a metabolic health practitioner. I'm the first in India. I'm the first, and probably the second is there's one more doctor who's practicing in India. So we are the only two guys. So what I want to stress upon this is like, we all know what low carb is, but then we need to have a proper knowledge. We need to have proper guidance, not only certification, but what we require is a group of people with us, like-minded people with us who will handhold each one of us. So even today, I don't consider that people call me guru. I'm not a guru. I'm a student because I keep learning from everyone. So I learned from you how you overcame your autoimmune condition with carnivore diet. So it is all, we all learn. So knowledge is not ultimate. It is learning. Even today, as I learn more, I understand that I actually know less, and there's an ocean of knowledge which you have to gather.
Absolutely, yeah.
And I think we are going to do that in the coming low carb conference. We are going to invite one of the top doctors. All the doctors are going to speak, not only in world but even in India. All those who are actively supporting low carb, they will come and express their views on low carb. So I think this is something.
I think it's going to be an eye-opening session for anybody interested in metabolic health as well as fitness, because in that conference you're going to be hearing from the best of the people working in the in this space. So it's going to be one very good event that I think nobody should miss.
It's going to be massive.
Yeah.
Massive. And it's not possible without all of us coming together, pooling our time and resources and doing it. And the best part is this is everyone can attend this. So they don't have to pay. There is no entrance fee or there's no registration fee, nothing. So people can come and see, and we are going to host it in, we are going to live stream it in YouTube and other social media. So we'll later put it up in YouTube also, so people later on can see. So it's something.
We are already updating a lot on Twitter. So those who are on Twitter can follow Shashikant Iyengar, and they would get updates about it. As we go further down the line, we'll keep updating our audiences.
So this is it, Hira. So
so Shashi, would you want to tell us about the recent case that you handled of chronic kidney disease, along with a host of other conditions that the person had? Please elaborate on that.
So I will more, in this case, I will more stress on how that case came, with high blood sugar and high blood pressure. So this case was a type 2 diabetic for more than a decade, very running high blood sugar. The fasting was around more than 200, postprandial more than 300, 400. In fact, in her history, I have seen even as high as 650 also in the lab report earlier, somewhere in 2020 or so. When they came to me, BP was 200 by 100, and they were advised by their doctor to get admitted immediately to a hospital, to an ICU or ICCU. 200 by 100 is just too high, and running high blood sugar. And from the report, I could see that there is the kidney size is smaller, and the report, the radiologists have mentioned as medical renal disease. So when the case came to me, it was referred to me by our friend. So I refused to take up the case because it is too risky, and I'm going to put my profession at risk by taking up such case, because anything can happen anytime. So the person can have stroke, the person can have huge heart attack or anything
And
can just happen.
what was the age bracket, Shashi, that the person
She's
had come?
66. And probably too careless and eating whatever they want. That's what happened. But my friend insisted that we have to help them because she was terribly scared of getting insulin injection and getting admitted about these two things. So they were sitting at home for 20 days at this level with all host of medication for 20
Yeah.
days. I don't know how. It is just miraculous.
Ah,
And my friend told that you just help them. I told them, okay, let us see for 2-3 days. If anyway, she was there at home for 20 days. So I told if 2-3 days she doesn't respond, they have to get admitted and I will not be available to them to any means. And started administering ketogenic diet, high fat, moderate protein, low carb. And then suddenly we found that in 2-3 days she started responding so well that the blood sugar and blood pressure just came down slowly. It was still higher, but she was just responding like anything.
so the difference was apparent in just 3 days.
3 days. Within 2-3 days. In fact, it was apparent with the first meal itself.
Oh,
So within 3 days, they were all little jubilant that they have not seen such response to anything, even for medication, they are not seen. And this is the magic of therapeutic carbohydrate reduction, or TCR, what we call. So you
yes.
reduce this and everything came down. She started responding well, and within a month or so, when they had to go back to the doctor, so they did HbA1c, creatinine, and blood pressure, everything came down. And then they visited a doctor. Then fortunately, doctor was not bothered about what diet she's taking. He was so happy with her. He
Yes.
told her that please keep doing what you are doing, and you are responding so nicely. Okay. So what has happened is initially when she came, her creat was 1.6. And after a month when they did it was 2. So I was I was little taken aback. It was not even so I was taken aback that why it has increased. But then we hypothesized that for 20 days she was sitting home with a high level, so it may be the case. So we just waited for one more month, and the next month it came down to 1.55, just below that
Wow.
initial
Wow.
start of 1.6
Wow.
or even 2. And repeated doctor visit was extremely, they were all happy. Even the doctor was very happy, never bothered what she has eaten. He told that you take what you want, as long as you are responding this way, I'm very happy. And then what
Shashi,
has
would you
happened
like
is,
to tell our viewers, if the person was a vegetarian or a meat eater, and
so fortunately she was a uh, non-veg, I will say.
oh, okay,
So that's what I did, and I administered protein in each meal. Now usually at this level of creatinine, the usual story is lowered on protein. So lowered on whatever pathetic protein they were having. So in this case, I raised the protein to 0.8 gram per kg body weight, which is the standard recommendation. Though
correct,
you can go up to 1 gram per kg body weight also, there is no issue.
correct,
But
yeah,
to be on the safer side, I administered 0.8 gram per kg body weight with a little higher fat content. And this itself is high protein for them.
yes.
As per the normal standard, as per what she was eating earlier, this itself is a very high protein. So this is, but then she has responded so well. And I always say that protein is the magic in our food.
Mm.
So when we say low carb, high fat, what matters is protein. It's protein is what creates that magic of lowering every number. And then what has happened was she ate something from outside and she was suffering from gastritis, severe, very severe, loose motion. She was admitted to hospital. Currently she's admitted there.
Okay,
But then in the hospital, when they measured everything, we saw that uh, creatinine has come down to 0.87, which was little, I was also taken aback. And they had done investigation of all the other parameters, ultrasonography also. And that what emerged was fatty liver. They couldn't see fatty liver in this, while the earlier report showed fatty liver.
oh,
And then what the radiologist has given was kidney size was normal, as
mm,
compared to the earlier one, which shows that it was a little smaller in size. Now I know that this is being, I posted this in Twitter. It was also hotly debated, and somewhere I agree. Okay, there could be a difference in the radiologist's perception or whatever it is. So maybe, as someone suggested, that we will again retest it after some time. But nevertheless, this is what on face value, this is what it appears, that
mm,
fatty liver seems to have disappeared. and kidney size seems to be normal. So, I used a word that kidney size grew, and then there was a lot of debate on Twitter. So let me put it in the right way, in the scientific way, rather than in a crude way, that kidney size appears to be normal as per the radiologist, where the earlier radiologist showed that kidney size appears to be a little smaller. So this is it.
Great. Great. Shashi, is age also a very, very, what you can say, does that compound the way you deal with the patient, with a client or a person who comes to you? Does it change the approach in how you, supposing a same case had come of a younger person and a same 66-year-old lady, would the approach have been different in both of them?
The approach will be same, because in the extreme condition, we will have to apply a ketogenic diet, because only that will work. The low carb will not work, because let us say if we keep administering more carbohydrate, then it is not going to really work. So I administer, see, the way I approach is totally different. So for different cases, it is different macros. So if it is a little milder case with not much on an issue, I can keep even little higher carbohydrate. I can keep little grain or millet as per the convenience. So that's what I do. But if it is extreme case, no, I will have to do. Now I'm working on one more CKD case where the creatinine was 1.8. Within 3 weeks, it came to 1.5. So that work is in progress, and that was also tweeted by me. So, and there's one more case in my own circle where the creatinine is very stable, though she couldn't follow as strongly as the other cases. But then the creatinine is very stable, and doctors are very happy that she can maintain as it is. So and even there, I administered high-fat ketogenic diet. So for me, at least in these 3 cases, I find that high-fat ketogenic diet is working, and it is consistent with a lot of other anecdotes which we keep reading, case studies which we keep reading. In fact, there is a nephrologist, I think in Brazil, who manages a dialysis center, and I forgot his name. So even he administers ketogenic diet in his patients to have a better blood sugar control, or even BP control. And there's one more, I think I forgot the name. So I'd seen his video long back. So we internationally, we have nephrologists recommending ketogenic diet in their dialysis patient to have a better blood sugar control and BP control.
Shashi, what would you advise to the people? As we saw, it was a chronic kidney disease, and the fear of protein associated with anything that has to do with kidney or uric acid. So was there something in this case? Were people apprehensive about it? How did you deal with that?
See, fortunately, in this case, what has happened is they were more terrified about insulin and hospitalization than ketogenic diet.
Yeah.
So this worked for me. I explained everything to him. I'm going to administer ketogenic diet. I told them, be rest assured that we can try this for 3 months. And see, like in this case also, I told them that if we normalize everything, she can go ahead, and if she wants, she can have a little more carbohydrate later on. She can take additional medication. I have no issue with this. Provided we reduce this, we will get this to normal. So getting it to normal was what my concern was. And I'll show you, it's very interesting to know that you should see this chart. And I think this is something which will be more convincing. So you can see this. So this is how, when she came to me, this is the blood pressure, and this is how it has happened later. This is the fasting, and this is how it has came.
Absolutely wonderful. Fantastic.
Same instrument. Yeah. Applied by same person. And the parameters here you can see. Yeah. Even the urea came down significantly. Uric acid was not much of an issue earlier, but then they are not done every. See, now these people are, they are not very affording people, frankly. Okay, they don't have tons of money to do a lot of investigation. So whatever possible for them, they have done. So this is what has been seen by the earlier radiologists in March, and this is what has been seen by the recent radiologist. So while this can be debated, can be that, which is okay. And I told them that probably, they can go back to the same radiologist and they can get this test done. In fact, I told them that I am willing to pay the money for them. Go to the same center and do this, because it's a very case study. I told them that I want to get more investigation done, and in the same lab, let them go and do. Yes.
So Shashi, please continue.
And I promise them that I will pay for it. you go ahead and do, because they're not too affording. But it's an interesting case study for all of us. It's a win for us. So that's why I
Yeah,
was
I
like,
think they started the keto diet on 23rd April, as I can see the chart. And I think within a month or something, just over a month.
as you can see here.
So yeah, this is 23rd April, and you can see significant change down 6th June, around the 6th
Yeah.
June.
And it has really come down. Even urea has come down now. They have not done the urea test earlier. I don't know. Even the doctors are not asked for it earlier. Ideally, it should have been asked at this creatinine level of urea, potassium, sodium, phosphorus, everything should have been. But the lab reports were not very consistent of what I would ask for. But I didn't ask for them later because they were not too affording. So they were cribbing to do a lot of tests. So that's how it is. So it's okay. So let us see. When they come back, I'll send them to the same lab, to the same radiologist, and let us see how it happens.
So Shashi, how does the family feel now from being on the verge of getting hospitalized and being insulin dependent to now
See,
this stage?
they were very jubilant. In fact, they were so happy that, and I promised them I'll come and visit her also. So I actually visited her. So fortunately, she's in Mumbai, so I visited her to reassure them. But they are all very jubilant that they have never seen such results for a long time, for very, very long time. They have always seen her at high level. And I always said that it is only God's grace, that she has God's hand on her head, that she has survived with even a blood sugar of 650. Can you imagine a blood sugar of 650?
Yeah, unimaginable.
Unimaginable. It is so huge. It is sometimes I don't know how. So that's why I say that, God was always on her side, is what I say.
And Shashi, would you like to briefly tell us, the age that she's at right now and the diet that you've prescribed? Generally, is she taking the same diet with a high protein now, or has that been pulled down a bit, fat increased, or how is it now for her?
Just a minute, huh? Yeah, just can you wait for a minute? I was just searching for something else. I think something we should record this. I want to show this. See, this is one of our lab report. Okay. See, this is postprandial blood sugar is 108. This was on 28 June. 28 June. Can you see this 636 on 2022?
Yes.
636. This is probably the highest I've seen. It is so crazy.
Yeah. It's actually so crazy. It's unbelievable. Somebody could even survive those numbers.
And this was done in the same lab. So no one can debate this. Same lab has the history.
Yeah.
So they are on the same diet now, but currently she is hospitalized for gastritis, severe gastric infection. So she will come back, I think probably discharged today or tomorrow. So in hospital, as usual, they are administering all high carb foods, and she's on insulin injection currently. So we'll see once she comes home, what we have to do.
So will she be following the same protocol, I think now?
I don't know. I am okay with her if she go back to high carb, but maintain insulin. Let her take insulin if she wants. I have no issue. But maintain a normal blood sugar. See, my contention has always been, whether you are on medicine or whether you are on low carb, please maintain normal level. Because even after taking medicine, if your levels are high, it is going to damage the kidney. Those who have high blood sugar and high blood pressure, it has a terrible consequences on the kidney. So please maintain either with a diet, either with a medicine, or a combo of both. But please don't ignore. This has always been my message, even in all social media. So let us see what happens when she comes. As of now, we are very happy that the level has come down. So we will see how. So once she comes back, I will probably send her to the same lab, same radiologist, and get the test done. Let the same radiologist do. So
I'm sure it will better over a period of time with the diet, because it already showed a great result. I think within 3 days, 4 days, and over a period of 1.5 months, it was significantly down. So I'm sure
this is a total of 3 months. Please, this is a total of 3 months. She has completed 3 months with me.
Okay. So anything else, Shashi, that you would want for the benefit of our audience to in a similar situation, who could be in a similar?
See, I think this case studies like these are actually giving us hope. And here I will not say that what is miraculous. What is happening is we are reducing carbohydrate to such an extent that everything comes under control. One. Secondly, if you really read now the literature, you will show that the drugs like SGLT2 inhibitors, now they are hypothesizing that mild ketonemia is what is helping all the end organs. It is known that ketones are superfuels for end organ. In fact, the failing heart depends upon ketones for energy requirement. So this is well known in the literature for donkey's years, I will say. But
Yes,
somehow,
absolutely.
these things are not accepted. Now they have drugs which releases ketones, and then they find it miraculous. But they think that uh, getting ketones from a ketogenic diet is dangerous. So this is such, it's a paradoxical statement, is what I will say, unfortunately. So for example, let me say that uh, GLP analogs. So they want to take GLP analogs for weight loss or blood sugar control. Protein does that. High protein does the same thing, but no one wants to do.
On the
So
contrary, people are scared.
yeah,
Like in my case, it
yes.
happened. Yeah.
So protein, see, there are studies even in in CKD cases which have actually shown that there has been hardly any difference between high protein and low protein diet.
Mm.
But the morbidity mortality was higher in low protein diet.
Mm.
It is such a paradoxical study. High protein, low protein, no significant difference, except the mortality rate probably would have been higher in low protein diet.
Mm.
These studies are there. Probably I'm going to tweet after this. I just recall, but I have those studies somewhere in my laptop. I'm going to tweet that after this.
Yeah, yeah.
So we
Your
should be
tweets are
understanding.
Yeah, your tweets are very informative, and I think all those who are here should absolutely go and follow Shashi because he keeps tweeting all these cases plus his own wisdom of being a metabolic health expert over all these years. So it will really benefit you. Anything else, Shashi, or
And okay, that's all, Ira. I think
should we
if you
open the
we can
question?
we can open for question and answer. So I think there have been some interesting cases here. People have mentioned here. Let me open people for unmute and start video. And there are a lot of questions here, but the one Dr. Mr. Raju, Dr. Gautam from Pondicherry tried a bit of customized keto for my father, ate and the diabetes reversed to normal. Recovered from arthritis, also semi-paralytic. Mr. Raju, you want to speak something?
Yeah, sure,
Abhinay
sure,
Rajan.
sure,
Please, please,
sure.
please.
Hi, hi.
I want to hear from you directly instead of me
Yeah.
reading.
Absolutely, absolutely. Yeah, thanks for this session, first of all. It's in benevolence for everyone because I have been a first-hand benefiter, my father's case especially. And Dr. Gautam Sarkar is our family friend for many years. And it was about 10 years back. My father is now 71. So it's about 9 years back to be precise. My father had developed very high diabetes, and he was going to typical diabetology control where they say there's 6 time meal,
Mhm.
small meals, and take this medication and so on. My father otherwise is very disciplined about his walking and even used to do asanas and stuff like that. But his sugar kept shooting up, and we went to Dr. Sarkar. He kind of said, it needs, it's not just your exercises and medicine that will do the work, but also to change the diet. And also, he says, you have to think also the worry part, which also affects our liver. It's psychosomatic. Diabetes is not just physical, but also psychosomatic. So then he basically recommended this. That's when I got introduced to what is keto diet, but he didn't tell me as keto, but
Mhm.
no cereal diet with a lot of fasting. And of course, my father's weight came down, but miraculously, because we had consulted a doctor, ortho for his knees, they said you have to do a replacement, knee replacement. And miraculously, even he was able to sit down, get up, walk up, down. Not only sugar improvement for 2 years, I remember very clearly. There's no issue. I mean, every time HbA1c was within the range. I still have those reports. Unfortunately, after that, mango season came and indiscipline set up, and then my father lost it. Even problem is, then basically Dr. Sarkar gave up. He's saying there's some sort of discipline is required here. See, either you follow the natural way of getting recovered, which needs some discipline, or you follow the allopathic method, which is not holistic, but that's the only other option that you have. So now he is following the allopathic method. Recently, I'll tell you also, it's like just to caution the thing, right? when we don't take these things seriously, how it escalates. Like recently, my father had a severe giddiness, was admitted in hospital, nearly a heart attack. He had to put a stent, angioplasty done. Of course, now we entered, the allopathic way of dealing with it. But even now, I'm in touch with Dr. Sarkar. He says, let him do this for 3 months, then let's see what we can do. He doesn't want to take risk because he says the discipline of the patient is very, very crucial for doctor to treat these kind of problems. So, what's your advice, sir, on this?
See, uh, the person has to be convinced
Yeah,
always. Otherwise, you cannot. You can take the person to drink water, but the person has to drink water. You cannot
yeah,
make him. You cannot administer. So it is his choice. Even for whatever clients I take, I tell them what it is, and I take them only if they're convinced of it. Otherwise, if they have an
mm.
iota of doubt, I don't take.
Oh, okay.
Person has to be convinced. See,
Yeah,
the low carbohydrate or ketogenic diets are all therapeutic diets. Actually, it will heal people. But if people are not convinced, then we cannot do anything. So
okay.
you cannot do anything. But I am so happy, surprised to know that there are gems of doctors like Dr. Gautam Sakar in Pondicherry. Maybe we should meet this doctor virtually one day. I am so
Sure.
happy to see that he has administered some modified version of ketogenic or some low carbohydrate, which we don't know. I think we require these gems to know. I want,
Sure, sure. I'll share his contact with
please,
you, doctor.
please,
How would I
please.
share? I'll send you a DM
You
in
can send a
Twitter,
DM in Twitter. You
or
can send a DM.
or if you could share your email ID, I'll send you an email,
I'll
doctor.
do that. I'll do that.
Yeah, thank you so
You
much.
just
Thank you.
DM me in Twitter. I'll share you my email
Sure,
ID.
we'll do that. We'll do that. Thank you so much.
Thanks,
Kind of you.
thanks.
Sorry to have
Abhinay
taken a lot
Raj,
of time.
thanks. No, you should see this program is to show to people that there are a lot of ways, and live case studies like you actually will help many people find a solution. See, there are many people who do not know that low carbohydrate way of life or ketogenic approach is available, or even for the matter carnivore approach at
Yeah,
ERA in last week. So people should know that this is an option is available. Maybe not
yeah.
everyone will go for it. I'll be very happy if even 4-5% of people will go for this approach and get benefit.
No, in
Just
fact,
imagine.
the what happened is, doctor. One more information is, Dr. Sarkar. Then he was in Pondicherry. Then he is back to Pondicherry now. He was in Meerut in Subharti University. He was a dean there, and he set up his own clinic in the university where he said, if you want a holistic treatment, come to me. Otherwise, there were two divisions that were set up in Subharti. So again, the takers are very less, but I think there are many who are slowly taking, and especially liver diseases, miraculous recovery. Thank you, doctor.
I think
Thank
we
you.
have one more question from Mr. Anand Ram. Shashi.
Yeah. High
Doesn't high
protein diet.
protein diet cause bloating and gastric problem? How to circumvent if we want to
I
adopt
mean,
and add intermittent fasting to our life?
see, actually, it doesn't happen. See, what happens is, I will tell you,
Hmm.
the entire problem comes because of excessive carbohydrate intake and that to refined carbohydrate intake. If you keep taking a lot of refined carbohydrate with this, the bloating comes from refined carbohydrate and we blame protein.
Yes.
Now it used to happen to me also. Earlier, if I used to take a lot of eggs, my eyes used to burn, stomach discomfort, and then people at home used to say you are facing heat, body mein heat ho gaya.
Yeah.
But then that
So
time I
stop
used to
eggs.
take a lot of bread along with that. I was not knowing.
Yeah.
Now I can tolerate 6, 7, 10 eggs at a time without heat building up. Why? It is that it is something which is causing it.
Yeah.
We have to realize this. So if you lower down, get off all this refined thing, it will not cause. Okay. And high protein diet certainly will not cause, but in some people it can cause, let me tell you, especially those who have lower stomach acid. Those who have messed themselves with lot of refined carbohydrate junk food, their stomach acid is disturbed. So
Yes.
you will have to actually make it little more acidic. Protein requires acid to digest. So I suggest for all of them, those who go for higher protein diet, initially to help your body, take some apple cider vinegar, take some lemon juice. This is going to help you in the transition period. And that's what most of us have done this.
I think in autoimmune conditions, I think the high protein diet or especially the carnivore, it works wonders. So I don't think people need be scared of protein, and I think absolutely go ahead with that.
No, but I don't want to really dismiss this thing. It can happen to some people. That's what I meant to say. It can happen. It is a distinct possibility because each one of us are different. It can happen. So how to circumvent that is have some acid. So you can adopt intermittent fasting to your diet, Mr. Anand Ram. Yes, you can do very well. If you adopt a higher protein diet, automatically your hunger signals will come down and you can easily do 2 meals a day. You can do 24-hour, 36-hour, 48-hour fasting if you want. There's no issue. I know of a gastroenterology renowned surgeon, Manipal. Yeah, in fact, Bangalore is one of the hub, I'll say, for low carb ketogenic diet. And there are a lot of gems. We have a lot of doctors who are doing, even we are not aware how many doctors are actually practicing. But then maybe we will know now in this LC conference where we invited some doctors. But then I know there are a lot of other gems we are missing. So probably in future programs, we can call more doctors also. Yeah. Anyone wants to ask something, any doubt you have, you can go ahead and ask. I think that's all.
I think you've explained it quite well, Shashi, and I think people have largely understood the point. I will wait for a few seconds if some questions come. Otherwise, we conclude the session.
Yeah, I can conclude the session. No issue.
I think there's a question.
Anyone is asking? No.
Is arthritis reversible? By Ram Sarkar.
Arthritis reversible, possible, because it's an autoimmune condition. So go more into meat-based diet. It is possible. Like Ira will specifically tell more on this. If you can go to carnivore diet, yes. If you go
I think
into
carnivore works the best for autoimmune. That heals the fastest. In my case, I had a miraculous turnaround in 3 to 4 months. So yes, you can expect it to heal on a carnivore diet better.
You can do that. There are also up your vitamin D is what I can say. Go to a doctor, check the level, raise your vitamin D. Vitamin D works like magic for autoimmune conditions also, especially
and
for
it is surprising, Shashi, that whenever we get lab tests done, usually vitamin D levels are not measured. In fact, so many other parameters are not measured.
It is not measured at all, but that is how it is. Because we have the sun avoidance issue. The moment you go out in sun, you go out, you will find the shade. You want to find the shade.
And when you advise, Shashi, have you ever come across a scenario where you've written down tests to set the baseline and people have come back and asked you why so many tests, why is D important, why is, so many other stuff important?
Can you repeat the question?
Yeah, I'm saying in so many years of your experience, since now we are talking about vitamin D and stuff like that, do people come back and tell you and ask you and be skeptical about how many tests you're going to make them do and whether they're important, not important? So
what happens is if a new case comes, then I give them a test package, which may not be too high costing, and then they do. But if they come back, they already have a few tests with them. Then what I do, I go through that and then ask for a few more tests, and then I explain the rationale for why we do. And then very often, what I say is right is what they find. If I say this is not measured and it is very critical, please measure. And usually it comes out in deficiency state also. So there is no, so people comply. If you give a logic reasoning, they will do. There's no issue. But then it happens many a time a cases comes and then when I ask for a few tests, then to our surprise, we find that there's a deficiency in that or there's an issue in that which we need to correct. So that's what we do.
So I don't think we have any more questions as of now. We could conclude the session.
Yeah, we can conclude the session. So,
okay.
So thank you.
Thank you, Shashi. Thank you so much for coming over and giving us this enlightening session and this case study and how you have, improved the condition of the lady. I'm sure she would do much better under your guidance. And anybody who wants to get in touch with Shashi can approach him on Twitter, or we'll also leave the links to all our podcast and the upcoming, all the announcements, Shashi's Twitter ID, my Twitter ID in the show notes below. So anybody wanting to get in touch with us can do so. Thank you so much, Shashi. Anything you wanted to say?
Thanks, Ira, and thanks, D-Life, for inviting me to discuss this unique case so that it will be beneficial to all. So my final word is not that everything is okay, hunky dory. No. So this is what we have seen initially. We will repeat all the tests to confirm how it is. We will let the doctor clinically correlate everything, lab reports as well as the radiology report getting done at the same thing. But nevertheless, what has happened is this such cases only gives us hope that there is a
Yes.
possible good solution for us.
Yes.
Thank you very much.
Thank you, Shashi. Thank you so
Thank you.
much. Thank you, everybody, for